Now, parasympathetic control, compared to having a system-wide response that occurs all at once, parasympathetic you can pick and choose. So just because you have parasympathetic activity does not necessarily mean that you're going to have parasympathetic activity in all the other organs. So it's less of a coordinated response and more like pick and choose what you want to do. So salivary and digestive gland secretion, yeah, that's rest and digest, but is that going to stimulate urination and defecation? Well, you can be eating, but are you going to eat and use the bathroom at the same time? Well, if that's your household, you do you. But the thing is that if you're just eating and just trying to enjoy your dinner, you might not necessarily be stimulating urination and defecation at the same time. You can pick and choose when to kind of do those, right? So if there's food in your stomach or something, yeah, maybe then your digestive tract will take over and start to move things along. But also, are you thinking about food and are you thinking about urination and defecation when you're crying? Well, maybe if you're stress eating, but again, you can have tear production with that independent of whether you're eating or using the bathroom. Sometimes maybe there is a situation where you do both, but it's not necessarily linked close together like it is with the sympathetic nervous system. And with the reproductive organs, are you going to think of what the dinner you had, or are you going to think about doing number one, number two in the bedroom? No. So the thing is that, or again, so the thing is that you're able to pick and choose. Not all of this happens at the same time. That would result in some very interesting relationships if people did all of this at the same time. But hey, no judging here if that happens. But the point here is that you're able to pick and choose what you want to do with the parasympathetic. Whatever you need to do, whether it's digestion, using bathroom, or things in the bedroom, whatever room you're in, that's where your parasympathetic, the appropriate organs kick in. Now, parasympathetic innervation, so why is it parasympathetic? So para also means to the side as well, right? Like paravertebral. So why is it parasympathetic? Well, if you put the two close, so again, this is the sympathetic nervous system. If you kind of overlay the two, parasympathetic nervous system, and again, this is another reason why that the parasympathetic fibers are longer in the preganglionic fibers. So notice that you have the sympathetic nervous system, the ganglia are very close to the vertebrae and spinal cord, whereas the parasympathetic, you have a further distance away from the spinal cord. Now, again, the arrangement of this, so again, and this is why we have that elongated, and this is why it kind of has at least if you're looking on the left side, it kind of looks like a big D, right? So why? Because you have longer preganglionic fibers and the ganglia are further away from the spinal cord but located closer to the target organs. Now, what happens with parasympathetic? How does your body react to parasympathetic activity? Well, you're going to decrease your metabolism. So now it's no longer you're not going to actually burn up your energy and your reserves. Now it's time to restore things. And then you're also going to decrease your heart rate and blood pressure because now you don't want to have it. Imagine if you were sympathetic all the time. I mean, it might be good if you're doing a workout or if you're going for a jog, but do you want your heart and blood rate and blood pressure and your breathing to be increase all the time? You want to dial things back to a normal level. So this is where the parasympathetic nervous system or division also helps out. But it's not just about decreasing things, also about increasing things. So remember that rest and digest, this is the digest part. You're going to increase your salivary or saliva production, so you're able to chew up your food and do some chemical breakdown of the food as well. And you're also going to increase the activity of all the abdominal organs that help you to digest your food. And increase digestive tract motility and blood flow, so you're also going to move the food more at a faster clip throughout your digestive system. And the digestive system, well, where do you get all your nutrients end up? They end up in your bloodstream, right? So you have all these blood vessels that lead to and from your digestive system. So especially the ones that lead from it, you're going to carry all those newly absorbed nutrients to the rest of your body. But you also need blood flow to actually carry those nutrients. So this is why you have increased motility over there. Now, Simulation of urination defecation. So this is another interesting thing. So this is like you also not just about digestion, but also like the waste products. Like say you have drank too much fluid, or say you have too much food, or you need to get rid of your food or whatever food you don't digest eventually, right? So this is where urination and defecation comes in play. And also increased tear production. This is pretty much specific to your tear glands or your lacrimal glands. And also sexual arousal. So this is why it's also nicknamed the feed and breed response, because the parasympathetic fibers also innervate and are involved in stimulating the activities of the reproductive glands as well and organs. And let's see, so another thing is like, okay, look at the anatomy of the parasympathetic nervous system. Let's flip it this way. So we're going to flip it this way, and another nickname for the parasympathetic nervous system is the D division. So I like to think of it this way. If you laid out the parasympathetic, the spinal cord, and the parasympathetic fibers, especially the vagus over here, and the sacral nerves, it kind of looks like a D. So parasympathetic is all about the D, right? So it's the D division. So what does D stand for? It stands for downtime, digestion, diuresis, which is the medical term for producing urine, and defecation, which is the medical term for producing feces. So is this all of this, the things involving the D? No, not necessarily, but this is showing you a lot of the things that involve parasympathetic activity.